Welcome to Homelessness and Animal Companionship 101, an overview of the research. This 45-minute session will review highlights from 3 decades of scholarly research on the topic of people experiencing homelessness with animals. During this time, we will delve into findings, glean insights, acknowledge the limitations of existing research, and open up discussion for how we use this foundational knowledge to move forward in academia and in practice. This session sets the stage for our subsequent office hours session with LA Family Housing, an interim housing operator who will provide practical insights into the implementation of co-sheltering practices. This is normally where I would introduce the speaker, but that would be me, and you all have been hearing from me all day, so we can skip that part. I will, however, introduce you to Vicki Ramirez, who will be helping moderate the Q&A at the end. So if you have any questions that come up, please feel free to drop them in the Whova Q&A at any time. Vicki Ramirez is the University of Washington coordinator for the One Health Clinic and senior research coordinator and center manager of the UW Center for One Health Research. As a medical anthropologist, Vicki is always looking at ways to improve health access and outcomes to those communities often marginalized. Utilizing the One Health lens, which focuses on the intersection of human health, animal health, and environmental health when looking to improve health outcomes, she helps support and manage the One Health Clinic through outreach, evaluation, and dissemination of key findings to support other organizations who would like to use a One Health lens in clinical care. Thanks for being with us, Vicki, and you all will see Vicki again towards the end of this session once we move into our moderated Q&A, which is really going to be much more of a discussion than anything else for this particular session. So I will be going through the research chronologically for the most part, starting with the early studies. There is a cluster of articles that emerged in the early and mid-90s on people experiencing homelessness and their pets. The most commonly cited ones are Benefits and Liabilities of Pets for the Homeless by Kid and Kid from 1994, and Dilemmas Associated with Rehousing Homeless People Who Have Companion Animals by Singer, Hart, and Zasloff, published in 1995. They're both published in the academic journal Psychological Reports. So at this point, these articles are 3 decades old. Both of these studies were conducted in urban environments in Northern California, one in Sacramento and one in San Francisco. Both studies examined attachment between people experiencing homelessness and their animals, and they also identified positive and negative qualities of the relationship or the impact that the relationship was having on the lives of animal caregivers experiencing homelessness. Attachment was studied differently in each of these studies. One of them established attachment qualitatively, and the other was measured using the Lexington Attachment to Pet Scale, and they essentially found the same thing. Animal guardians experiencing homelessness showed very strong attachment to their pets, and for many people, the relationship with their pets were their only relationships with other living beings. So some direct quotes from the qualitative research, quote, "My pet is my whole life. He's my friend, my pal. She keeps me alive. When I had radiation and chemotherapy for cancer, I wanted to die, but I couldn't because she'd have been an orphan and no one would care for her and probably would put her down." And those are all direct quotes from the research from the Kid and Kid study in 1994. The study using the Lexington Attachment to Pet Scale found that their study participants, all of whom were animal guardians experiencing homelessness, had significantly higher mean scores on attachment to their pets than did the scale's standardized population. Some of the liabilities, in quotes, formally documented through these early studies were that there were no human shelters that permitted pets. Where my pet can't go, I won't go. That was a thing that was frequently said by the study participants in the Kid and Kid study. It's It's also important to note that the study identified that this was a population reluctant to utilize shelter already. So many participants had stated that they had not gone to a shelter, nor did they plan on it. The study was not clear on whether or not that was because of the no pets allowed rule. However, it is very clear that the no pets allowed rule doesn't help. In the study that used the Lexington attachment to pet scale, most participants did state a preference for being rehoused. However, 93% of men and 96% of women said that housing would not be acceptable if pets were not allowed. 61% of men and 33% of women stated that they would be willing to live anywhere pets were allowed except in a shelter, assuming that the shelter even allowed pets. A majority of the participants had been refused housing because they had pets also. So also feeding the pet was identified as a problem. Some guardians stated that they would feed their animals before they feed themselves, sharing their own food with their animals. And this is something that we heard from Dr. Jyoti Robertson as well, right? Dr. Jyoti and Heather Camisa from pethelpfinder.org, they did that study with Meals on Wheels America, and they were finding, just exactly the same thing. People will feed them their limited human food and feed their animals before they feed themselves. Also, obtaining veterinary care was identified as a problem. It's too expensive and it's too unaffordable. Dog licensing came up as an issue. They needed a fixed mailing address and also proof of a rabies vaccine, which the guardians could not afford. And because of this, they feared that their unlicensed pets would be forcibly taken from them. The discussion section in both of the articles identified that the pursuit of housing and shelter are complicated for people experiencing homelessness with an animal. And this is a direct quote, right, from the authors of this very early study. To provide for this group of pet owners, the needs of the people and of the animals need to be evaluated as an integrated problem. It is clear, however, that the bias against homeless people who have pets is strong, and adequate affordable housing that includes pets is difficult to find. That's from a study 30 years ago. Both identified that shelter is not the preferred option, housing is. Both identified that the animals provided friendship, loyalty, and protection, and that the animals possibly buffered the stress of homelessness. The results of this study, and this is another direct quote from Seymour Hart and Zasloff, the results of this study point to the value of considering the homeless person and the animal as a unit and working to create a responsible living situation for these human-animal pairs. So for those of you who are not academics but are practitioners in the field, either in homeless services or in animal welfare, all of this should sound wildly familiar to you, even if you've never read these studies. I'm sure a lot of this rings true to you in your practical experience. So the aughts, in the aughts, this is really when we see the emergence of the importance of animals in the lives of youth experiencing homelessness in the research. 3 standout studies from this period on youth experiencing homelessness with companion animals are Friends and Pets as Companions, Strategies for Coping with Loneliness Among Homeless Youth by Rue, and that was published in 2000. That was a qualitative research study which interviewed 32 homeless youth from the ages of 15 to 23. So they did both focus groups and individual interviews with these 32 youth experiencing homelessness. And what they found mainly was the profound loneliness that youth experiencing homelessness experience. So homeless adolescents who live on the streets or in squats described feelings of loneliness that they say can, quote, go with the territory. The 3 themes emerged from the data were how lonely subjects felt, circumstances that provoked feelings of loneliness, and ways of coping with that loneliness. Many of the participants identified their pets as companions that provided unconditional love, reduced feelings of loneliness, and improved their health status. So in conclusion of that article, vulnerable adolescents who are homeless often recognize the therapeutic value of pets. And for us in this room, that seems pretty common sense. But that was something that the research at that time had brought to light. The second article that is listed here, Insights from the Street, Perceptions of Services and Providers by Homeless Young Adults. This study was really interesting. So what the study was trying to get at was to understand how to get youth experiencing homelessness to engage and use services, which can be a challenge because youth who have needs for health and social services often do not utilize or they underutilize available care. So the question is, how do we catch young people before they get entrenched in street culture? To develop a better understanding and increased knowledge of barriers and factors that affect service utilization, focus groups were conducted with 60 participants recruited from a drop-in center for young adults who were experiencing homelessness. Qualitative analyses found participants responded favorably to they responded favorably to respectful, empathic, and pet-friendly providers who were supportive and encouraging without disregarding their autonomy. So all of that makes perfect sense, right? Of course, the young people are going to respond well to providers who are respectful, empathic, supportive, encouraging. Don't disregard your autonomy. And I think the thing that was new here was that pet-friendly providers was also thrown in the mix. They really responded well to pet-friendly providers. The last study that is listed here, Capacity for Survival, Exploring Strengths of Homeless Street Youth by Bender et al., published in 2007. So this is another qualitative study. It wasn't looking at young people experiencing homelessness with pets specifically. However, through their broader purpose to explore the personal strengths and informal resources street youth rely on to navigate their environments, pets came up in a very significant way, particularly as being a source of motivation that encouraged them to improve their lives. And I included a screenshot here of the article, and this is actually Where My Dog Is My Home. That's where we get our name from. It is a direct quote from the literature and an interview that was done with this youth experiencing homelessness. So the top part here talks about how, again, in a study that wasn't particularly about pets, the young people experiencing homelessness talked about pets most passionately above everything else. And the quote here is, "A dog gives you somebody to talk to. I mean, my dog is my home. He keeps me warm when it's cold and gives me somebody to talk to when I'm walking down the highway." The researchers concluded that the results of this study provide valuable insights into the strengths of homeless youth that can be useful to providers in assessing street youth services, street youth service needs, and increasing the likelihood of long-term positive outcomes. In the late aughts, there was a very important study that came out of the University of Tennessee in Knoxville. It's called Homeless People Who Are Animal Caretakers, a Comparative Study, and it was done by Cronley et al., published in 2009. This is one of my personal favorite studies. It's one of the few that uses a large sample size using an existing federally mandated homeless information collection tool. So up until this point, and also for quite some time afterwards, we're looking at a body of literature that has a strong qualitative bend to it, or small sample sizes with limited generalizability. In Knoxville, Tennessee, the data from a homeless management information system, or HMIS for short, were used to compare people experiencing homelessness who reported caring for animals with people experiencing homelessness who did not report caring for animals, based on demographic variables and stated reasons for homelessness. So among the clients surveyed, we're talking about an N or our participant pool of over 4,000 people. 5.5% reported animal caretaking. The findings suggested that first-time homeless Euro-American women who were experiencing homelessness due to domestic violence were the most likely to say they were caring for animals. The use of such an information system could aid in identifying this subpopulation and coordinating services for animal care. Dr. Patterson was a speaker at our conference in 2022, and he gave an update on the HMIS data. What was interesting was that the number dropped just a little bit from 5.5% of people reporting animal caregiving to 4.36%. And that of the people who had reported animal caregiving, the number of people who had reported domestic violence as a prior living situation had also dropped significantly from 8% to 0.23%. So these were the comparisons from 2009 versus 2021. So why do I like this study so much? Because people always ask, how many people experiencing homelessness have animals? And that's a completely reasonable question to ask. Measuring that accurately and with rigor has been difficult because measuring homelessness overall is also very difficult. HMIS presents the best, most comprehensive way to capture this data in communities, I believe. It's a federally mandated tool that every community must use already. And every person who touches the homeless services system supposedly gets entered into the system. There's another federally mandated tool that captures community level data to quantify homelessness. And that's the point in time count, where communities go out and do like a literal head count of people experiencing homelessness in the winter. HMIS is a much more comprehensive system, and it captures people all throughout the year and in different situations. So I'd like to see data collection nerds and advocates move away from advocating for pet questions in the pit count, although that is also very good. But I would love to see us move more towards adding pet questions into HMIS. All right, so sociological narrative studies, Dr. Leslie Irvin. So once we hit the 2010s, Dr. Leslie Irvin breaks open the conversation in a whole new way. We owe Dr. Irvin a lot at My Dog Is My Home, so we put her and her work up on a bit of a pedestal, and I even have a fun animation here for that. Her writing, her style, her approachability brought the subject a different life, not just to academics, but people who are sort of academic adjacent or in the practice world. You can read her work, know it meets rigorous research standards, but also not feel like this belongs in some like sacred vault in an ivory tower. So the three studies that are listed here, these all came out in right around the same time, or I should really say that there are two studies in one book. All of these studies and works show a positive identity formation by people experiencing homelessness who care for their animals. Their animals help them, but the human caregivers also take good care of their animals, and they feel good about that, long story short. So other things to come from looking at the narrative that people experiencing homelessness tell about their relationships with their animals are right in the titles of these studies. Animals serve as life changers and redeemers, and they eat first even before their people do. Does and the phrase that she uses in her work, the domiciled public. So does the domiciled public need to worry that the animals accompanying people experiencing homelessness are being abused and have bad lives? Homelessness is not the condition that should be driving those questions. One Health, One Welfare starts to emerge a little bit later down the line in a study that I like to bring to light is the one that was put out by Jordan and Lem in 2014. So a little bit further down the timeline around this time, we see the emergence of the One Health framework explicitly applied to people experiencing homelessness, their animals, and their access to homes or the lack thereof. So I credit Dr. Michelle Lem a lot, the founder of Community Veterinary Outreach, which started in Ottawa, Canada in 2003. Today, there's a rich and growing body of literature on the health and wellness of this population of people experiencing homelessness and housing insecurity and their animals as it relates to their housing, thanks to folks like Vicki Ramirez, who will hopefully chime in later to talk about where this body of research is now today. But even early on, when there were a few other voices in the field, Dr. Lem was finding in her research that you can improve the health and utilization of health services by integrating systems of care across human, animal, and environmental health, or in this case, the housing and shelter services, much like researchers are finding today. In the late 2010s and moving forward, we see more articles also being published about the body condition of the animals themselves. Dr. Lem co-authored several articles measuring the body condition of animals kept by people experiencing homelessness, which found things like, with regard to exercise, homeless-owned dogs received more exercise than housed dogs. In this study, homeless-owned dogs had significantly lower body condition scores spread over a healthier range than for non-homeless-owned dogs, of whom were more likely to be overweight or obese. So there was actually another study she co-authored a few years later, which found that her sample wasn't exactly in better body condition, but the animals of people experiencing homelessness or housing insecurity are generally healthy, and that there are similar risk factors for increased body condition scores and overconditioned status to animals seen in private general veterinary practice. So again, sort of going back to this idea that like, oh, that animal must be abused, that animal must have a terrible life. Oh my gosh, that person's not taking care of their animal simply because they're a caregiver that is experiencing homelessness. That really is not the case. That is not what the research has found. And then there's a much more recent study. We have an article that was co-authored by Temple Grandin. In this study that was just recently published in 2024, researchers looked at the physical and behavioral health of dogs that were kept by people experiencing homelessness. A survey was carried out along with a visual assessment of the condition of the dogs for 100 human-dog dyads in the Western United States. And the results showed that dogs of homeless persons were well cared for and physically healthy, which was consistent with other studies, and had few behavioral problems, but did display evidence of separation distress while the owner was away. Results from this study can provide information that may lead to policy and practice changes, including, for example, changes to policies and practices prohibiting dogs from being kept with their people while staying at a homeless shelter. And this brings me close to the end here. So in the very late 2010s and early 2020s, which we're obviously still in, we're seeing much more mention of pets and permanent supportive housing, or by major researchers in the permanent supportive housing world. In 2019, an article was published in Evaluation and Program Planning called "If You're Going to Help Me, Help Me: Barriers to Housing Among Unsheltered Homeless Adults," which was co-authored by Dr. Deborah Paget at NYU. She's a rather big name in the world of homelessness and housing first research. So for this study, the researchers interviewed 43 unsheltered individuals in Manhattan to identify the barriers to service utilization. In New York City, there's a mandated right to shelter. So the folks who are unsheltered in New York City are likely people who are experiencing chronic homelessness, very entrenched individuals and highly vulnerable, where conventional homeless services just do not work for them. Permanent supportive housing and housing first is exactly the right approach for this group of folks. So in their interviews, they found that there were 4 common barriers to accessing housing and other services, which were obtaining required identification documents, lack of accessibility of shelters amid complex healthcare needs, waiting as a part of the process, and number 4 was exclusion of pets from shelters and housing options. So virtually, and this is a quote, again, directly from the article, virtually all barriers street homeless New Yorkers face stem from bureaucratic policies that, however well-intentioned, do not address their diverse needs. Thus, long delays and poor communication combined with crowded, unsafe shelters, lead to frustration and alienation. While homelessness is ultimately the result of a severe and chronic shortage of affordable housing, creating accessible, safe, pet-friendly shelter and safe haven options and instituting a smoother, more transparent process for moving from the streets could substantially reduce street homelessness. There's another very big name in homelessness and housing first research who has recently been adding to the scholarly work on how animals overlap with human homelessness, and that's Dr. Benjamin Henwood. Dr. Henwood was a keynote speaker at one of My Dog Is My Home's previous conferences, and he has also served as the methodological lead for the Greater Los Angeles Homeless Count since 2017, which is the largest unsheltered count in the United States. In 2020, the Journal of Social Distress and Homelessness published Pet Ownership in the Unsheltered Homeless Population in Los Angeles, which was co-authored by Dr. Henwood. The study used surveys collected as a part of the Los Angeles County Annual Homeless Count across 3 years, from 2017 through 2019. Estimates of pet ownership among unsheltered homeless adults were 12% in 2017 and in 2019, and 9% in 2018. Among pet owners in 2017, 48%, that's an N of 1,362 people, reported being turned away from shelter because of pet policies. This is by far the largest study of its kind. In 2024, so very recently, Dr. Henwood also published the article Placement into Scattered Site or Place-Based Permanent Supportive Housing in Los Angeles County, California during the COVID-19 pandemic. In this study, researchers were looking largely at who was approved for and received permanent supportive housing in Los Angeles during the COVID-19 pandemic. And for those who received permanent supportive housing, was there a difference between who received what's known as place-based versus scattered site supportive housing? Place-based and scattered site are the two dominant ways of implementing supportive housing. So, and I'll explain it a little bit more. Place-based is when a provider owns and operates an entire building where all or the majority of the tenants have a history of homelessness, and the supportive services like case management and healthcare are located on site. Scattered site, on the other hand, helps people with a history of homelessness lease apartments in the community from the private market housing. Case managers or healthcare teams often provide support services through home visits. So the case managers will go to you instead of all of the services being on site where you live. There's no formal guidance on who gets placed into either one of these models. So it's not like there's a clear directive or a decision tree that people who have these conditions go into place-based and these people go into scattered site. Guidelines only specify that permanent supportive housing should be reserved for those who are the most vulnerable with complex health needs. But this study was, again, looking at whether or not there was some sort of emergent pattern in who received place-based versus scattered site permanent supportive housing, as well as who was approved for permanent supportive housing but did not actually receive it. And the researchers did actually find that there were notable differences between these groups. The sample was asked what housing needs they had, and participants were given a list of factors from which to choose their requirements. On the list was A, they're allowed to stay with partner, spouse, or family member. B, must be handicap accessible. C, in a particular neighborhood. D, allowed to stay with pets. E, a lot of space to store possessions. F, live with other veterans. G, other, and H, none of the above. The most common housing needs in the sample, again, these are requirements that people are checking off, like I must have this requirement in order for this to be an acceptable place for me to live. The most common housing needs in the sample were allowances for a spouse, partner, or family member at 39%, or a pet at 37.8%. So that was a requirement, followed by having adequate space for possessions at 33.4%. So a significant, right? That's a significant finding, a significantly higher proportion of people experiencing homelessness unassigned to permanent supportive housing. So they were approved, but didn't actually make it into permanent supportive housing for whatever reason, indicated that a requirement for pet allowances, there was a significantly higher proportion of people who indicated that they required pet allowances in PSH than those in the other two housing groups. And so, sorry, I think I muddled that. Let me say that again. People who indicated that pet allowance was a requirement for them, they were less likely to actually make it into permanent supportive housing. They were approved, but less likely to actually make it into permanent supportive housing. So lastly, people experiencing homelessness needing pet accommodations had significantly higher odds of being assigned to place-based permanent supportive housing versus scattered site permanent supportive housing. So the fact that people experiencing homelessness needing pet accommodations were also more likely to be assigned to place-based versus scattered site suggests that landlord preferences may play an important factor here. All of this is to say that if we look increasingly at permanent supportive housing as a solution to ending homelessness for our population, not shelter, this study is suggesting that we're running into the same problems here, actually. So a person being able to stay with their companion animal is identified as a top priority in order for that housing placement to be acceptable to them. They marked it as a requirement. People who have pets also may I don't know why I'm struggling so much with this particular one. People who have pets may also statistically have lower odds of actually making it into permanent supportive housing, even if they are approved for it. And if they do make it, they're more likely to be in a place-based setting rather than a scattered site setting, because perhaps we'll have an easier time finding an affordable housing developer and operator willing to take a person and their pet, as opposed to the landlords of a regular market unit in the community. Okay, so here we are at the end of a non-exhaustive review of 30 years of literature. I hope I didn't bore you all too much. And I really mean it when I say it's non-exhaustive. There are a lot of articles I skipped over, but I think most of us get the gist. And we got it at the very beginning, actually, with the early articles published in the mid-90s. People experiencing homelessness have animals. They're highly attached. They play an important role in the lives of their people. And where their animals are not welcome, whether that be in shelter or in housing, their people are reluctant to go. That was true 30 years ago, and it is still true today. It's frustrating, but it's also somewhat normal. It's well understood that there is a lag with the translation of research into practice. The commonly cited estimation is that it takes roughly 17 years for 14% of research findings to be implemented into routine practice. I'm just going to move along in my reference list here. And these slides will be posted to Whova, so don't feel like you need to copy everything down. It's hard for me to say if we're at that point, 17 years, 14% of research, but I feel like that's a really low bar, right? Also for the co-sheltering, co-housing field that doesn't really have many evaluated practices in the way of housing and sheltering people with their animals. I think on the veterinary side of things, there might be more in the way of evidence-based practices or what's becoming evidence-based practices. But on the shelter and housing side, what we have is a growing body of literature that has identified and established over and over again that there is a need for more homeless services that will accept pets on site. We have not moved into the phase where we have evaluated practices. Can we say that sheltering and housing people with their pets leads to better outcomes? Probably, but I don't know if there's really enough research to confirm that from like a researcher's point of view. So I know all of this sounds kind of negative, but it's actually an exciting place to be. There's a lot of opportunity moving forward to start looking at our programs and practices. Instead of just reinforcing that there's a need, we can start to evaluate what practices are in place now. And we're actually at a place in this movement where there are places that have been doing this for sometimes a very long time, right? I named a couple of organizations at the top of our day today, celebrating 10 years of supporting, human-animal bond or co-sheltering, co-housing people and pets together. What a wonderful chance, what a wonderful opportunity to evaluate what they're doing. So with that, I'd like to open up for conversation. And again, more of a conversation, not so much a Q&A. I would love to know what people think. And I will leave it at that. And let me go ahead and show off the last piece of the reference list here. And again, these slides will be posted, so no need to jot all of this down. And I will stop the screen share and pass things over to Vicky because I can't see what's going on in the Whova chat.
Yeah, thank you, Christine. That was amazing. And you have been very busy putting that together. And if anyone has any particular questions, feel free to either put them in the chat or in the Q&A. I would like to start. So for me, coming from academia, coming from university, we are always looking for opportunities to look at data and look at and kind of try to create these articles that are being published. And there are so many nonprofits out there in the world doing amazing work, but they don't have the capacity perhaps to sit down and look at data because data is a whole other job out of their responsibility line. How would you suggest integrating like the nonprofit and academia, or kind of how do we move towards data analysis and publication just so we can disseminate that information?
Oh, I feel like that's a better question for you, Vicky.
Well, no, because I give me the data, we'll take care of it. But how can we make those connections where it benefits the organization themselves in addition to the field of science?
Yeah, I think I'm always sort of shocked at the level of the lack of community engagement on the part of universities and researchers. Like, they've done all of this hard work, and then it doesn't really feel like that research goes anywhere except into an academic journal that you have to pay for, or you have to belong to an institution in order to access it. And I think that a lot could be done if academic institutions started implementing practices much like outreach practices, the way that nonprofits do, actually. So in the same way as that animal welfare is really starting to think about, how do we get ourselves into the community instead of expecting people to come to us? And in the same way that, like, Breaking Ground, for example, has a street team that goes out there and engages people instead of expecting them to go to you. Like, I think academia needs to take that same approach. Like, they really need to get that work out there, and not necessarily do it in a way that, is about having a lecture style presentation in a classroom, but to make that information accessible. And even then, like, I feel like there are some really good academic communicators out there that do a good job of writing op-eds and putting things in magazines and things like that. But even then, it's like, who's really reading the New Yorker? Like, like, it needs to come down to earth a little bit more than that, even. So I think that there's a lot that, the folks who work in universities can do to just make sure that they're speaking to people, like actual people.
Absolutely. Yeah, so I think on our side, when we publish, we try to make everything open access, but the reality is that open access could be like $3,500, $5,000. That's the cost to get it published. And just as a pitch, ASPCA actually has a program that will help provide open access fees for animal related research. So everyone out there, y'all, just try that. I'm looking at the chat window. It says, if there is a paywall, I'm reading, well, I haven't read these yet. If there's a paywall for any of the literature, I may be able to bypass that. Oh, so can I. Ask your local academics. We can get you access to articles if you need them. And that was Shelby Kleiner who is offering that as well.
Very nice.
Kimmy Stevens, my apology if I mispronounced that, do presentations at institutions or places where people may want to volunteer to help local nonprofits with data entry or collection for a school project or volunteerism. That's a really good idea. I'm sorry, I'm answering. It's just because I come from the university world. If anyone is close to university or even not, a lot of the Masters of Public Health students have to do practicum. And the practica often has to benefit the organization that they're working with. So it's not for their own thesis, it's not for their own work. It's supposed to be practical learning experiences. So if you're near a university and you have data that you want to have looked at for the benefit of both your organization and for the writ large, contact your local university. Sorry.
Great. Thanks, Vicki. We actually have to hop over to our next session.
Okay.
Yeah, but everyone keep putting things into the Whova. All of that gets saved in the app. And so Vicki and myself, we can always go back to it and keep that conversation going. Thanks, everyone.
Thanks, Christine. That was amazing.